So I'm going to sort of break this up into two parts. The first part is going to be what thought should go into deciding what species, what animal model you're going to use if you're going to look at some in vivo study design. And the second part is going to be when it comes time to submit sort of your animal protocol, your animal care protocol to the animal care committee, what are the things that they're going to want to see in order to give it approval. So what is in vivo study design? We talked about a little bit last night, and really it's experimentation on a whole living organism as opposed to just part of an organism, a tissue or a cell or a subcellular level. Now that sort of depends on the area of interest. If you're a microbiologist or a fungologist or whatever, then you can experiment on single cell organisms and you say that's in vivo work. But for most of us doing sort of work related to humans and human biology, then we're really relying on full organisms, so mice, rats, and whatnot. And so for most surgical applications, this really refers to animal testing. Okay, so why is this necessary? Why don't we just go in and just start doing human work? Well, we really can't. Okay, it's not possible for us to just sort of run out of animals and say, okay, we're just going to go and sort of work on some humans, although in some situations it may actually be worthwhile, if we've got sort of lawyers we can experiment on. Okay? So there's a couple of reasons, and this sort of fits right between in vitro work that we spoke about a bit last night, as well as clinical work. So the biological processes that we sort of deduce from in vitro work might not apply in the whole organism, much more complicated, and what looks successful in a culture dish or in a test tube or in a petri dish, whatever, might not apply in the whole organism. So if we've got a promising intervention, you really have to take it to that next level. And as well, it's unethical to experiment on humans. So just because it works in a culture dish, some drug works in a culture dish, we can't automatically say, oh yeah, we got to go and start giving this to humans and miss that important animal step. Okay. Now it doesn't apply all the time. For example, you didn't see last night Mike McKee talking about sort of growing clavicular osteoblasts in a culture dish and then plating mouse, clavicles. So it doesn't apply to every research study. However, certainly most novel interventions, drug therapies, things like that, you really need to go through these individual steps. So how are you going to choose what animal model you're going to use? How are you going to choose your species? And it really depends on several factors. It depends on the disease you're looking at, what intervention you are interested in, what outcomes you're going to look at, how much money you've got, what facilities you have to house your species, and what your own personal training is or the training of the people that are going to be doing the work for you. And as I said last night, don't reinvent the wheel, okay? It'll take a long, long time, often, for you to come up with a model that somebody else may have already invented. So the first step is look through the literature, see what's out there, and if something parallels what you're interested in, by all means, go and use it. So if nothing's available, then you got to commence one. You got to figure out some model, okay? And the first step is sort of take some pilot studies, and I'd say it's sort of akin to a phase 1 trial, okay? You don't want to embark on some big animal study if you really don't know how your model works or if it's going to work. So the first thing is try it on a few animals, make sure it's something that is reproducible, generalizable, that animals aren't dying all over the place because of your intervention, okay? So just to give you a few examples, osteoarthritis. If you're interested in studying osteoarthritis, there are many, many different types of animal models. So there's ones that occur spontaneously, these certain strains of guinea pigs, mice, and hamsters, they just spontaneously occur anatomically or biochemically. I'm not too sure how it happens, but they just spontaneously develop osteoarthritis. There can be surgically created osteoarthritis, and there's models of meniscal tears in rats and rabbits, meniscectomy, ACL transection in larger animals, and they fairly reliably develop, osteoarthritis, as you see here, after this meniscus has been resected. Injecting various different, you can inject bacteria, you can inject chemicals into the joint, and they can develop osteoarthritis, and you can get transgenic mice that can also develop osteoarthritis. So those models are there. What about fracture healing? Well, mice and rats, they're usually models of closed fractures, so some type of external trauma is applied to the thigh, causes the thigh to fracture, and you can sort of percutaneously insert some type of internal fixation. That's a well understood model. Larger animals, rats, rabbits, dogs, usually those fractures are created by an open procedure, corticotomy is made, some type of internal fixation is put in. Other kinds of the diseases, well, Emil Shemich has done tons of work on sort of fat embolism and trauma and whatnot, intramedullary nailing. Dogs are very good for studying cardiorespiratory effects of any type of surgical intervention. Studying cancer, as we do a fair amount at our place. A lot of mice and rats can be used, as we discussed last night. You can make knockout animals, you can do transgenic animals, anything like that can be predisposed to developing cancer, including sarcomas, which we're interested in. Lumbar disc degeneration, rabbits seem to be a fairly popular model for that. Okay, what's your intervention? That's the next step. Well, if you're looking at hip and knee replacements, good luck doing it on a mouse, right? It's just not obviously going to work, right? So you got to use larger animals like dogs and sheep. If you're interested in looking at just percutaneous fixation, mice and or rats and rabbits, after you've created that closed fracture, can be effectively studied. If you're ever looking at fractures with bone loss or the effects of open fixation of fractures, that's again a little bit difficult to do in smaller animals, and you've got to go to the bigger animals: rats, rabbits, sometimes dogs. If you're looking at cell therapy as your intervention, really mice or rats are ideal because you can get transgenic cells that you can label, for example, inject it into the animal, and you can track them and find out the fate of those injected cells. You can, if that's the case, then you can get syngeneic rats so that there's no rejection. Okay, you can take rats from one individual of a Wistar rat and inject it into another, and it won't be rejected. If you're looking at using human cells, studies of human cancer or other types of interventions, then you really got to use immunodeficient mice, for example, the nod-skid mice that we talked about last night a little bit. Okay, what about the outcomes? All kinds of different outcomes you can look at: radiographic, histological outcomes. You can look at immunohistochemistry. You can look at things on a smaller level, the cellular, molecular, biomechanical level. There's another possibility, and sometimes it's important to examine multiple of these things, right? Because if you get one result, you can often explain it by the result of something else. If you see that fractures aren't healing, and you look at things on a cellular level or molecular level, you may be able to explain why that's the case. These are all things you have to consider in the cost: how much it costs not only to purchase the animal, how much it costs to house them, okay? The cost of anesthetics, analgesics, antibiotics, all these things have to take place and be factored in if you're doing any animal surgery. Your surgical instruments, implants, anything like that, you have to factor it in, as well as disposal of the animals once you're finished with them. So you got to check with your facility. If you set out your facility, you say, okay, I'm going to do this operation. I'm going to put a bunch of knee replacements or hip replacements in dogs, and you get all set, and the facility says, sorry, we can't house dogs here, then you're up the creek a little bit. All right, so you need to make sure that your facility houses them. Specifically, if you're looking at some mouse animals or some mouse strains, transgenic mice, for example, you often you can't import a whole bunch of mice from one facility to another. They don't allow it because of contamination. And so oftentimes you're just limited to having like a breeding pair, and they've got to breed up and reproduce and essentially start up a whole other colony in your own colony. You got to take an approved animal care course, all right? And that's really available at any animal colony. Usually limited to smaller animals. If you're looking at the bigger animals, then you've got to find some specialty training somewhere else. So there is this Canadian Council on Animal Care. CCAC, everything's got the acronym CCAC for some reason. I don't understand that, but so all animal protocols, no matter where you do it, okay, has to be approved by an institutional animal care committee, and it includes several people: a veterinarian, scientists, the manager of your animal facility, as well as lay people. All right, so everything has to be approved by these people. You can't start doing animal studies without approval there. And they look at these various factors before giving approval. They look at what's the potential benefit of your research. What are the alternatives to animal use? Is there a good mathematical model or computer model that can be done instead, or biomechanical testing on saw bones or anything like that? What species you're looking at, what type, how many you're going to use, how can you reduce the number of animals, what your description of your intervention is. Obviously they want to know that in some detail. What endpoints are you looking at? And then with respect to the effects on the animal, are you going to use any type of restraint? How much pain and stress do you expect that to cause? Are you using analgesia, and how are you going to sacrifice the animals? So a few words of advice. When you're planning out the number of animals and estimating it, it's sort of tough. You want to overestimate to some extent because animals can die during your procedure. You don't want to say, I'm only going to use this, 100 animals, and you find out that 50% of them go on to die. Okay, so you're going to be out of luck in that situation. So you got to anticipate animal morbidity, and you got to sort of estimate a larger number of animals. However, don't order far too many because the cost will go up considerably. Okay, it's fairly expensive to house these animals. You can limit your numbers sometimes by looking at multiple outcomes in the same animal. So don't have one set of animals where you're just looking at histology, and then another set you're looking at immunohistochemistry, and another set you're looking at radiographs. Combine them all together. That way you get the same results in a whole bunch of different animals. And you do want to do a sample size calculation from similar investigations maybe you've done or somebody else has done on that same model. You want to include your anesthetic that you're using, be it inhalational, injectional, however that is, intraperitoneal, subcutaneous, analgesics, antibiotics. All these have to be considered in your application. What are you going to do with the animal afterwards? You got to keep them warm. You don't just say, I'm going to stick them in the cage because they'll get cold and they'll die. So you got to keep them warm afterwards. All these things are very important. They're going to look at these critically. There's this grading scale for how stressful your procedure is going to be. All right, from 0, no pain or suffering. You just take some blood, or you just give a subcutaneous injection, all the way up to grade 2. So creation of fractures, implanting tumors into the animal, which can cause some fairly significant stress, albeit it tends to be fairly limited in the time. Grade 3, something like you implant a tumor in an animal and you leave it there until it dies from the tumor, usually frowned upon, so usually that will not get approved by the Animal Care Committee. And then in terms of your actual surgical procedure, it's also graded 1, 2, 3. Most of the things that probably orthopedic surgeons would be interested in terms of interventions would sort of have this higher rating of 3: joint transplantations, joint implantations, fractures, that type of thing. So fairly significant, and you need to be aware of the Animal Care Committee's somewhat reluctance to approve fairly stressful procedures. Okay. In terms of the endpoints you're looking at, you don't want to, as I said, impart too much undue morbidity. You want to look at the early signs of stress, and there's a list that the Animal Care Committee will request you and require you to be aware of and assess. You want to look for wound complications. You want to make sure the tumor grows to a reasonable and manageable size. You don't want a tumor that's like bigger than the animal growing out of its back, because it'll like fall over and they'll be kicking and screaming because they can't move. I've seen that happen, and it's really frowned upon. All right. You got to be very organized when you start to do this animal research, because sometimes if you've got multiple steps and you just set out, you got a whole bunch of animals and say, okay, I'm going to do my surgeries on 10 of them today, and next week I'm going to operate on another 10 more. What you may find is weeks down the road, you're going to have like about 40 different animals you got to do different things on the same day. So it's best to sort of set out with a calendar and plan on what you're going to do, what your next intervention is, what's your next step, what's your analysis going to be, and essentially plan your next 6 months or year or whatever it's going to be. Okay, that way you avoid conflicts. So, it's very tempting if you find some promising result in, cell culture work or an in vitro work to jump ahead and do a clinical trial. And it's easy to be tempted because animal work is very time-consuming, it's very laborious, and it may find that your results go in the toilet. Okay, you may find that it's something that is completely different, and it will, end up being fruitless. However, if you find a positive result in an animal trial, then you're much more likely to get approval and come up with a successful clinical trial subsequent to that. So it's really worthwhile to do.